Clinical scenario. Joshua is a 40 years old male who presents to the clinic with complaint of right shoulder pain. Hi Joshua, my name is Guillermina Rojas, nurse practitioner. I will ask you some questions and later I will perform a physical examination. When did the pain start and how? Could you show me where the pain is located? How long does the pain last? How frequent do you get the pain? Could you describe the pain? How severe is your pain? On a scale from 0 is no pain to 10 is the worst pain you ever had. Could you describe it, please? What aggravates your pain? What alleviates your pain? Does the pain spread anywhere else? Are you taking any medication for the pain? Are you taking any over-the-counter medication? Does the pain interfere with your daily activity? What kind of work do you do? Have you experienced an accident? Have you experienced any surgery? For the diagnosis, some tests needed to be performed. First, I will order X-ray to check any damage to the bones and your shoulder joint. Also could be ordered ultrasound, MRI. This imaging investigation produces more accurate images of the soft tissue. The MRI looks for damage to the ligaments and tendons that surround your shoulder joint. Also could be ordered a CT scan. This equipment combines X-ray and computer technology to provide a detailed image of the bone in the shoulder region. Also, electrical study. These tests assess the nerve functions such as EMG, electromyogram. Also, arthrogram. The dye is injected into the shoulder during this X-ray examination to show the joint and its surrounding muscles and tendon. It might be used in conjunction with an MRI. Arthroscopy. A fiber optic camera is used to see into the joint during this surgical operation. Soft tissue injuries that are not visible on physical examination, X-ray, or another testing may be discovered using arthroscopy. In addition to assisting in detecting the source of discomfort, arthroscopy may be used to repair the issue. After all the data collected, the possible diagnosis is a rotator cuff injury. Rotator cuff injury are the most common cause of shoulder pain in people of all ages. This symptom may appear early in persons who work in professions that demand repetitive overhead movement, such as your work as a welder. A detailed history, physical examination, and in many cases, imaging studies are used to make a diagnosis. Non-operative or conservative therapy is typically adequate to resolve the issue in the great majority of people. For you, I will start with conservative treatment. Rest will be the initial step in the therapy. Also, I would recommend heat application in the affected area. I would prescribe an anti-inflammatory such as ibuprofen for 1 month. If the discomfort doesn't go away, cortisone injection in the affected area will be administered. I will refer you for physical therapy. And surgery will be the last resort if none of the other therapies work. Differential diagnosis. Bicipital tendinitis, also known as bicep tendinitis, is an inflammatory process that affects the long head of the bicep tendon, which is a common cause of shoulder pain due to its position and function. Bicep tendon disorder can occur due to impingement or as a single inflammatory injury. Cervical radiculopathy is caused by a disc herniation or acute injury that causes foraminal impingement of an excited nerve in the younger population. Cervical radiculopathy is caused by disc herniation in 20 to 25% of the patient. Another differential diagnosis is arthritis The most prevalent kind of shoulder arthritis is osteoarthritis, sometimes called wear and tear arthritis. Typically, symptoms such as edema, pain, and stiffness occur around middle age. Osteoarthritis develops gradually and the pain is caused progressively intensified. Osteoarthritis is a condition that can be caused by sport or work-related accident or by persistent wear and tear. Other forms of arthritis may be caused by rotator cuff injury, infection, or joint lining irritation. Okay, thank you, Joshua.